Expired. Mr. Smith is recognized for 3 minutes.
Thank you, Mr. Chairman. Thank you, Madam Secretary. I want to touch on a few budget-related health care items, the first being critical access hospitals, and the second being the Medigap plans, and then also this new fee increase at FDA to cover a 17% increase in their budget, if time allows. But regarding the critical access hospitals, as you know, and I think you can appreciate service in a rural state, how important health care is, and these critical access hospitals really are modest gateways to health care, or entry points to health care. And the President's budget has proposed reducing the reimbursement to critical access hospitals. Can you tell us kind of the background to that strategy and what the impact might be?
I can't do it with any precision in terms of the years that it would hit. I share your concern about the importance of critical access hospitals, and I know in the overall payment strategy, we're continuing to pay an increased amount to critical access hospitals as we move forward, recognizing that often they are the only service provider in an area and that it's essential to keep them there. But I can get you a more detailed answer in writing, sir.
I know they're very concerned about the proposed reduction, and so I do look forward to hearing more on that. Now, the budget also recommends that seniors with the Medigap plans, which have near first dollar coverage, pay a surcharge equal to roughly 30% of their Medicare Part B premium. Can you speak to why the President recommended this policy?
Well, I think there's a market strategy that indicates having some investment among consumers in the Medigap plans is actually a positive step forward. So he is following some recommendations that have been made over time and looking at some of the market strategies that seem to be effective.
So, I mean, what do you see the impact being? I know that, I mean, I hear from seniors concerned and obviously providers as well what that impact might be.
Well, I think that there are a variety of plans, many of which, as you know, do not provide $1 coverage from the outset, and we've looked carefully at the health outcomes, measuring the plans. This is seen as a way to not only produce some revenue in the long run, but also discourage what may be redundant use of services and have some strategies in place that actually are more cost effective. But there are a variety of plans that currently, without any impact on beneficiaries, don't have the $1 payment by the company.
All right, thank you.